Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to go over some of the different options for ice machines and icing methods after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button and turn on the notifications if you aren't a subscriber already, so you can be sure to catch all of our latest videos related to knee replacement surgery. So, first of all, when it comes to different ice machines out there, most of them are going to be very similar, have very similar benefits, and be just as effective as any of the other options that are out there. Just a quick Google search, a quick Amazon search, and from my experience in the clinic, some of the different options, there's the Polar ice machines, there's the Game Ready machine, there's Aircast, there's the Berg Polar Care, Donjoy, Osser, and the Kuzum, or Kuzum. I don't know if I'm pronouncing that right. But basically all of these are very similar in terms of how they work and how they function. So what you do is basically you take the container, the ice machine, and you fill it with water and you fill it with ice. And one of the tips I get a lot from patients is to use water bottles and fill the water bottles up and then freeze them, and then you can just stick the water bottles in the ice machine so you don't have to constantly replenish your ice every time you use the machine. So then what they do is when you turn on the machine and you have the cuff that's around your knee joint, and ice cold water is going to circulate throughout the tubing, throughout the cuff and the machine. And that circulation, that movement of the water is actually going to increase the coldness and how cold it feels. There's some physics behind that, but I won't get into that here. And then also, the vast majority of these machines are going to provide some level of compression, some level of squeezing, which of course is going to help with managing swelling. So first of all, do I have one that I particularly like or that I would say that I would recommend? No, I don't. I've used the Game Ready. My patients have used the Game Ready machine and it works perfectly well, perfectly fine. I have people who've used the Polar Ice. I've had people use the Aircast, the Donjoy, and nobody really has any significant complaints. Of the complaints I do hear, usually it's about leaking of the machine. Usually this can be managed by just taking good care of the ice machine and also just good setup. Make sure there's not really many kinks in the tubing, make sure everything's attached and clicked in appropriately, and that can help limit any of the leakage of the ice machine. Also, I would recommend when you do use these ice machines is try to elevate your leg, usually up on some pillows. We're getting the benefits of the ice and the compression, and just adding that elevation can further improve those benefits of decreasing that swelling, decreasing that inflammation in the leg and in the knee. Some other things I would recommend is just taking good care of your machine, so try to clean it at least once a day, let it air dry between uses so there's not a buildup of mold or mildew from using it constantly, and just taking good care of it, and in that instance most of these machines will work just as well as any of the other ones. Now of course, if you don't want to get a machine and purchase a machine, you can use ice packs, you can use the gel packs, you can fill a Ziploc bag with ice cubes and put water in it. All these things are going to work just as effectively and be perfectly alright. What I like to do is get like a wrap or a bandage. So the one we use is called the Nylatex wraps. There's these blue wraps that you wrap the gel packs around the knee, and so it stays in place and doesn't move. Some other recommendations is be sure to look into your insurance. If talk with your surgeon's office, talk with your insurance, and a lot of people, they actually end up able to rent out an ice machine and take an ice machine home from the hospital with them throughout their recovery and kind of rent it out week by week after surgery. So be sure to look into that, and the free option to get an ice machine, that's there's nothing that can beat that. Other things, look at if you're trying to purchase one by yourself, look at secondhand options, look at eBay, look at Facebook Marketplace, ask around in some of the Facebook groups that are out there for knee replacement surgery, and see if you can get one that's relatively cheap, relatively inexpensive. So really those are my main recommendations. Again, I don't have one that I would say is my go-to or my favorite. I think most of them work just as well as any of the other ones. And if you don't even want the machine, you can just use some gel ice packs or, ice and water in a bag. It's, you can go back to the traditional way, works just as well too. So hopefully this gave you some useful insights. Of course, if you have any questions or comments specifically about ice machines or knee replacement in general, be sure to leave them below and I'll get back to you. Thank you very much for watching.